This segment demonstrates the value of an informal facilitation style, including use of humor to create a relaxed setting. Posing reflective questions supports contemplation and critical reflection about practice. A conversational tone and interactive style during group work, including validating well-constructed responses, encourages active learner participation. Summarizing, restating, and providing active clinical content messages is part of the facilitator's learning leadership role.
Now, the interesting thing is in prostate cancer, the likelihood of it fracturing is less than another type of cancer causing a lytic lesion, but it is still there. The orthopods would tell you, oh, if it's prostate, it's less likely. But if it's a very large lesion, I think there's certainly still a risk. But I'd agree with you. We would do an X-ray.
Is it neuropathic or nociceptus?
Nociceptive.
And is it somatic or visceral?
Somatic.
Multiple choice is always easy. Okay, and it's related to his prostate cancer, right? Yes. Okay, so he's got it lots of places. So the second question, does Fred have any poor prognostic factors for pain control? And why are these useful to know? So think back to the assessment. What were some, we just talked about it.
The alcohol.
Yeah. So that's one thing that you definitely want to be talking to about.
Right, so let's titrate the pain, the opioid. Hopefully we don't titrate the pain, right? Okay. So let's assume now Fred comes back 2 days later and he says, you know what guys, the pain's a little bit better. It's about 6 out of 10 now, but it's still far from being well controlled. Okay, and we have him on morphine 5 milligrams every 4 hours. How much would you increase the dose by? Exactly. So one way is to look at breakthroughs. You're going to say something, aren't you? 10 to 20%. Okay. So 10 to 20% will give you what, up to 6 milligrams.
Per dose.
Yeah. So 20% increase on 5. Yeah.
So I think you could go up to 10.
Right.
And
Exactly.
maintain the breakthrough.
Right, so that's the key thing we're getting at here. And Eva, I don't know how much would you have increased it? From 5 to what? So at the lower dose ranges, the 5, 10s, 15, etc., then because usually the rule is you need to increase it by at least 20 to 25%, as Nadia said. That's the general rule. But at the very low dose ranges, you're not going to make a big difference going from 5 to 6. So probably in someone who's not too frail, I'll probably go from 5 to 10, as you said, Nadia. 5 to 10 milligrams every 4 hours.